Okay, we're live. Hey, Leyla.
Hi,
Hi. Thank you so much for being here.
thank you for having me.
Of course. We'll give everyone a few minutes to join. For those of you that are already on the call, thank you so much for being here with us. If you will let us know, there's a chat box. If you're on your mobile or on desktop, there's a chat box on the right-hand side. If you'll just let us know where you're dialed in from today, where you're located, and if you're willing to share, you certainly don't have to. Let us know where you are in your parenting journey. If you are trying to conceive, have been trying to conceive, if you already have a family and you're trying to grow it, just let us know sort of where you are in your journey. And either way, we're thrilled to have this discussion with you guys today. So anyway, yeah. Tanya is from California, but go Yankees.
I love that.
Awesome.
My hat is just for decor. I'm not really a baseball fan, I'm not going to lie.
It's cute. Either way, it works. Mom of two with her on the way. Congratulations. Awesome. All right. Well, we'll let everyone sort of get settled in. I'll go ahead and just introduce myself quickly, and then Leyla, I'll hand it over to you. And just for the sake of time, we'll just get right into it. So sometimes we have people who join us for multiple webinars, but I always like to let you guys know. I'm Sarah, the founder of Populist, a simplified baby registry platform. I'm a mom of two. Amelia, she is 5.5, and Zoe, she's 2.5. I'm located in Austin, Texas with my family and my husband, Scott. Running a registry business is obviously a dream come true, but hosting a webinar series like this, we call it unsolicited advice because, as most of you know who are trying to have a family or already have a family, when you mention that to someone, the amount of unsolicited advice you receive is endless. And so we hosted the webinar series, and we call it solicited advice because we try to gather the information you actually need from experts, not just people who think they know best, but from actually people who do and have lived it and have been through it. So today I'm honored to have Leyla join us. She is one of the co-founders of Dandi Fertility. She's an RN and she has over 10 years of experience in this industry. She's also a mom of two. I'll let you introduce yourself a little bit, and then Leyla, we will just jump right into the discussion. But thank you so much for being here.
Yeah, thank you for having me. I'm a mom of two. I have two daughters, Jordana and Callie. Almost 4 and almost 6. I am a fertility patient myself. I've had secondary infertility. It's been a little over 2 years now from my fertility journey. And I also actually used to work in pediatrics before fertility. So I'm very familiar with baby registries and newborn prep and all that kind of stuff as well.
Awesome. Well, thank you so much for being here. So for the people who aren't familiar yet with Dandi, can you give a little bit of overview of what the company is, what you guys do, and really the inspiration behind how you guys got started?
Yeah, sure. So Dandi Fertility is a combination of fertility products and fertility services. So I had been running my own fertility concierge nursing services business a couple of years into working at a fertility clinic in New York City. I didn't mention that I am New York City based. And I just realized that there was all these little gaps, like all of my patients who I was doing at-home injections for and little things like that, extra to what I was doing in the office, I kept noticing the same pain points coming up. And so I started my concierge business to kind of fill this gap. And I was working on the services, and then my co-founder was working on these products to make the actual physical injection process more comfortable. And one of my patients was an earlier advisor for him. And so we kind of, he introduced us, we joined forces. And so now we're the first and only holistic fertility care brand. We're combining the virtual care services. We are going to roll out at-home injection services to help people through administering their injections as well. And we have this beautiful kit that people can purchase that will actually help you feel physically more comfortable with the injections. We have a cooling pack, we have a heating pad, we have a massage roller, and it's all hands-free. So just like you would have a hands-free breast pump, all of this is hands-free. You don't need to be stuck into the wall with your heating pad and things like that.
That's really nice. Awesome. Thank you for sharing that.
Yeah.
So I'm just curious. You said had experienced secondary infertility. What does that mean exactly? Secondary.
So there's primary and there's secondary. Primary is you haven't been able, I shouldn't even say you haven't been able to get pregnant. You haven't been able to carry to term and have a successful pregnancy with a live birth.
Okay.
Secondary is anything after you've already had at least one. So
Okay.
whether you have 3 kids and you're trying for a 4th, or you have 1 kid and you're trying for a 2nd, that's what we label secondary infertility.
Okay.
Meaning you've done it before, but for whatever reason, you can't do it anymore.
Okay. Got it. Thank you for sharing that. I hadn't heard that term before.
Yeah.
So really, like, the meat of our discussion today is when you are trying to have a family and you have visited your OB-GYN and things just aren't happening as quickly as maybe you were expecting. And as I was researching, this webinar and working with your team, one of the things that became apparent to me in our DMs on Instagram, the questions people submitted beforehand, there are thousands and thousands of like Reddit conversations and threads about trying to conceive, people's expectations that just weren't met, people thinking it would happen so much faster than it did for them, and just overall just frustrations and disappointments, and people just unsure what to do when they don't get pregnant. So when you are having these appointments at your OB-GYN and things just aren't happening, what do you tell your clients? How long do people need to wait to try naturally until they might need to start asking certain questions of their OB-GYN? Like, can you just help sort of set the stage and maybe like a general timeline of what that might look like for somebody?
Yeah, sure. So I think a lot of also like our society is very instant gratification. And so technically between the ages of like, let's say 25 to 35, it's completely normal for it to take an average of a year for you to get pregnant. With each cycle that you have, most people only have a 30% chance of getting pregnant with each natural cycle. And I think that people don't realize that. I think people think that like the second I'm ready to start trying, if I stop taking birth control, stop using a condom, and I'm timing it correctly, even if you're timing ovulation perfectly, there's still only a 30% chance that it happens every cycle. That's pretty low.
Right.
So I think that there's this expectation that like the second I actually actively start trying, it should happen. So like I have friends even that would come to me, they're like 32, 33. And if by month 2 or 3 it hasn't worked, they're in full blown panic. But it's actually very normal for it to take an average of a year. So you can be less than that, you can be more than that. And then we say 35 and up, 6 months is that number. Now, all of this can be true, but it doesn't mean that you have to wait. And so I think a lot of people prefer not to, and that's okay. And so that's what like OBs will tell you. And that's why most OBs aren't jumping on it. If you've been trying for 2 to 3 months and it hasn't worked and you go to them and tell them, well, why hasn't worked? They're not jumping to send you to a fertility specialist.
That makes sense.
Technically that's not marking infertility. And so they just tell you to try for another couple of months. But you can go to a fertility specialist as long as your insurance allows it. You can go to a fertility specialist whenever you want. And you can go have that workup done whenever you want. It is a little bit different than what the OB does. The OB is limited in what they can do. Not only is the OB limited in what they can do, they also are limited in what they can interpret and how far they're willing to interpret. So they have this scope, this little nice little, package that they like to work within. And so even if they can write you for the extra tests that the fertility specialist will do, or even if it's just blood work that they can do, they might not want to touch it because they're not going to really have action for you. And so they'd rather you go to a fertility specialist and figure it all out there. And OBs are generally don't ask, don't tell. Not that they don't want to talk about it with you, but if you don't ask them, they're not going to prompt you until it's been, let's say, like a year and it still hasn't worked. Then they'll say, okay, I think maybe you should go see a fertility specialist.
Okay. And are there instances where they won't recommend a fertility specialist? Like, have you heard scenarios where they just would prefer to keep you under their care?
I know some OBs will do the more minimally invasive fertility treatments, like the oral tablet induction cycles, ovulation induction cycles, we call them. So like not full blown IVF, but like if you're doing just a medication to kind of help you recruit hopefully a better follicle with that has an egg in it, and then time your ovulation with a transvaginal ultrasound. Some OBs are willing to do those minimally invasive treatments there with themselves, and some don't like to touch it at all, and there's a whole spectrum. So it really is OB dependent too. Every OB kind of runs their practice the way they want to.
Right. And then that's assuming you actually see your OB, because a lot of times I saw, not the actual doctor. I saw maybe the nurse practitioner or someone else in the office.
Yeah. And it also depends. Like some offices have a standard that all of their practitioners go by.
Mm-hmm.
And some don't. Each OB within the practice does their own thing too. So it really is dependent on those kinds of things. The bottom line, if you want to go see a fertility specialist for a workup, you absolutely can. Very few insurances these days actually require referrals for specialists.
Okay, that's what I was going to ask, if you need a referral.
Very few actually require it, even for like going to your dermatologist these days. Very few insurances require referrals anymore. It could be though that you go to a fertility specialist, and even if you have fertility coverage, the initial consult may not be covered. So you're paying, anywhere from $200 to $400-ish for the consult. And then the fertility treatment, if you are going to receive treatment, will be covered. But the referrals, you don't necessarily need anymore, depending on your insurance. Most of them have kind of done away with that. But of course, check with your insurance. And then they can let you know if they have a referral requirement.
Okay, that sounds good. I have just a few more questions about meeting with your OB. What are some questions that you might recommend a patient or a family ask to advocate for themselves if they don't really understand the fertility markers or the infertility markers? Are there specific questions we can ask our doctor to help us identify if and when we need to see a fertility specialist, if instead of just time?
So outside of time, one of the biggest red flags is your period.
Okay.
If you get your period regularly or not. And what I mean by that is, for example, since I was 12 years old and I first got my period, I have gotten my period every 28 to 31 days without fail, almost every single cycle. And that's a huge indicator. If you're somebody who has cycle 1 month and then you go 60 days in between cycles, or you are spotting throughout your entire cycle, any changes outside of the regular, I get my period every, let's say even less, 25 to 31 days. If you have an irregular cycle, that is an immediate red flag. Not to say that means you can't get pregnant, but that's something that should be evaluated for sure. And then the other thing is, there's this whole myth about birth control causing infertility. It's not that it causes infertility, it's that it can mask infertility. So let's say you do have irregular cycles, but you're on a birth control where you never get your period. If you never get your period, how would you know if it's irregular or not, right? And so that's another thing. If you've been on birth control for a long time, you don't really know. And so often patients who come in, we tell them wait at least 3 months after you've come off your birth control for us to evaluate what's going on, because it's going to take some time to regulate back. And then if after the 3 to 6 months, you're still not getting your period regularly, that's a red flag for us. So your period really is a great indicator. If you don't get your period regularly, if you don't get your period at all, those are huge red flags.
Okay. That's really helpful to know. Thank you for sharing that.
Yeah. And then the other thing is, if you've had any sort of abdominal surgery or a history of STIs, sexually transmitted infections, especially if you've had an STI that's led to PID, pelvic inflammatory disease. So either that or an abdominal surgery, for example, like an appendectomy, if you had appendicitis and had your appendix removed. When you have abdominal surgery, that can shift your reproductive organs around in certain ways. That can also cause fertility issues. So if you have one or both of those things, those are also things that we would recommend going to see a fertility specialist for more immediately.
How interesting. I've never, ever heard anyone mention the latter.
Yeah. Yeah.
Wow.
It's, I never thought about it until I started working in
Wow.
fertility.
Okay,
Hmm.
cool. Thank you.
Yeah.
Yeah. Agree, Sandra. It's a great point. Um, okay, so how do people find fertility specialists? What are we looking for when we start this journey outside of our OB?
Yeah, so it depends where you live. Like I know New York is very saturated and you have so many good options to choose from. It's like a good problem to have, but you're like, well, then how do I know who to go to? Some of them don't take insurance, so that's one thing. If you have fertility coverage, you should try to go to someone who takes it because these days the fertility benefits have gotten much better. So some are cash pay and some take insurance. That's the first thing. And then if you want to go by stats, there is a website. It's sart.org, and they have like actual data points, statistical outcomes for clinics all around the country so that you can see which ones have the highest success rates based on, if you're doing IVF or any other type of treatment. So there's SART, which shows people's success rates. There are Facebook forums and things like that. And I think it's beautiful that people who have gone through infertility like to pay it forward and want to have this sense of like helping others based off of what helped them. I would be careful of those because my best friend could love a doctor and I could hate them and have a terrible experience with them. Part of what we do at Dandi, which is part of the services that I had started with and we, brought them into Dandi, is that I guide people through how to find the specialist for you based on your personality too. Some people don't care about bedside manner. Some people just want the success rates. I want to see the data. I want to see what the success rates are. I don't care if you're warm and fuzzy or not. And some people really do need the hand holding. Maybe they have had a lot of loss and miscarriages and they really do, they have PTSD and they need a lot more hand holding. And then in those cases, we would send you to a warm and fuzzy doctor. That doesn't mean they're going to be a bad doctor. We just know that like that's a higher priority for you. And that does make a difference, believe it or not, in your treatment. It is a very intimate thing. It's not your PCP. It's not getting a physical once a year. You're with them a lot. And so like meeting the nurses, the front desk staff, who's answering the phones, all of those kinds of things are going to affect your experience. Fertility IQ is a great resource for that. They've done a great job. They came out years ago when I first started working in fertility, and this couple who went through it, and it's genius because they have reviews down to the people who answer the phones.
Oh,
So
wow.
people will write in there, this is the doctor's office that I went to. This is a clinic that I went to. And the front desk staff was X, Y, and Z, and the nurses were X, Y, and Z, and the finance people were X, Y, and Z. And so Fertility IQ does also a really good job of breaking those kinds of things down.
Okay, thank you so much for sharing that.
Yeah.
One of the things that we talked about that I want to share or make sure we discuss on this call is, when we were prepping for this webinar, you talked about our regular health versus reproductive health. And I found that so interesting because I don't know if people separate the two when they think about trying to start a family. Can you just talk a little bit more about what that means to you and how important that might be for us to consider when we start trying for a family?
Yeah, I think people don't realize that like your reproductive health and your regular health are separate. For example, I have patients that come in 48 years old and they're like, "Well, I'm perfectly healthy. I feel great. I'm in great shape. I'm going to go ahead and have a baby at 48, or I'm going to go ahead and freeze my eggs at 48." And we're like, "No. Unfortunately, your general health and feeling good and being in good physical shape and your biological health, your reproductive health do not necessarily correlate. You could be the healthiest person and have fertility issues that, like, for example, let's say you were congenitally missing a fallopian tube or both fallopian tubes. Now that's a rare thing, but you wouldn't know that, right? Because that's not something that would show in your regular everyday health. You could be perfectly healthy and just be missing those vital pieces of your reproductive organs. And we wouldn't know that until we did a specific test to look for that. So there are things I think that affect your reproductive health that you can be perfectly healthy otherwise. And you would never know. And even in the fertility testing that we do, I was telling you before, like when we check someone's thyroid level, I'll call and say, your thyroid level is a normal adult level. You would have never been flagged for this at your PCP up until now, but it is a little bit elevated for what we like to see when we're trying to conceive and for pregnancy. So your regular health, a lot of things can be benign to your regular health and actually be, a block in your reproductive journey.
Are there other things that you like to tell your patients, hey, start doing this for your reproductive health? Are there suggestions that you like to give people that you can share?
Yes, and again, this is one of the things that like I would take caution with on these forums, and people who try to sell fertility supplements and all of these vitamins and things like that. Not that they're harmful, but if there was black and white data showing that these things worked, every clinic would be mandating them because that would increase their success rates, which would then increase their business. And so again, with all of these, it's kind of like proceed with caution. There is a list of supplements that I give, and I will give a medical breakdown. This is part of what we do with our Dandi consulting services, is that we'll give you the actual medical breakdown of how these supplements are thought to work in reproductive health. And we tell you the pros, we tell you the cons, we tell you that we can't guarantee that it works, but it's not harmful. And so, yes, there are supplements that we tell patients that they can take that can be helpful. But there isn't, unfortunately, there's no like answer outside of me telling anyone who is curious about their fertility health, who is worried about their fertility health or their reproductive health, to just go and get a workup done. I think a lot of people are fearful to go to a fertility clinic because they think if they go for the consult, they're going to be thrown into doing IVF or thrown into a treatment that they don't want to do. And that's absolutely not the case. I think that truly knowledge is power. There are so many things that you don't know until you go. I was 28 when I started working in fertility, and I had been a nurse for a good amount of time. I worked in pediatrics and newborns, and I had no idea even the details of my own menstrual cycle until I started working there.
And
so
what does workup mean? Like blood panel?
the basics
exactly?
of a fertility workup, you sit with the doctor, they go through your health history, they go through your family history, they go through your family plan if you have one, or if you're there to preserve your fertility, they'll go through like what your ideal outcome is. And then after you meet with them, they will do a transvaginal ultrasound where they insert the probe vaginally. So that is important for people to know, because I do think it's jarring for a lot of people that they go for the visit and all of a sudden they're like kind of at an OB visit where they're getting probed, and that can be jarring for someone. And so a transvaginal ultrasound is always a standard, and then blood work, yes, is a standard. So that's like the workup that they do in office when you go for your consult. And then from there, they may recommend other more invasive things depending on your history.
Seems like such a great option to do no matter what.
Yeah, absolutely.
It seems like such interesting things to know about your body. Okay. Primal Queen supplements. Okay, I'm gonna let you take that. I don't know. That's a real specific question.
Yeah. So again, those kinds of supplements, like as practitioners, your office, your fertility clinic is always going to say, we can't really say for sure. Anything that doesn't have an FDA category assigned to it, or like people come to us with Chinese or herbal medicine, we can't comment on that because we don't have testing on it. So we can't really tell you for sure it works or not. I can tell you that most of these supplements are not harmful. And so you can always try them. If you are going to take any supplements that are thought to improve your egg quality, those do take, I would say, about 3 months at least to kick in. So if you are going to do those kinds of things, you do want to do it preemptively. It's not like if you're starting an IVF cycle today and you start it today that it's going to really be helpful to you.
Okay, do you see her second question there, Leyla?
I don't see. I only see.
Oh, here. Let me pull it up for you.
Thank you.
Is there any recommended blood work not typically done that you would recommend to show if fertility is quote unquote off?
The recommended blood work that they do at the office is the AMH and your FSH levels. Those are the two biggest markers. The FSH is cycle dependent, so we do recommend doing it in the beginning of your menstrual cycle. Of course, if you have irregular periods or you don't get your period, then you would just do it at random. But the FSH and the AMH are the two biggest markers for us in terms of blood work. Now, if somebody has had repeat loss, they're having continual miscarriages and things like that, there are other blood work panels that your doctor can recommend. But those two are like the initial ones that we look to kind of see where you're at baseline before we start any type of treatment.
Cool. Thank you. Ashley, let us know if that helps you. One of the questions that came in early this morning on the registration was, are there any infertility misconceptions that you like to share? And if so, what are some of those?
The biggest one, going back to the birth control, that's a big one. And I feel like it still lingers. It's kind of like when like the anti-vax thing started, where like it still has left like a lingering impact, even though data has shown otherwise. It's the same thing with birth control. Birth control does not cause infertility, but it can certainly mask infertility. So that's like a huge one. I also think, I was naive in that my OB always said to me, you get your periods regularly, so you'll be fine. Right. And yes, that is a huge red flag if you're not getting your period or if you're not getting your period regularly. But it doesn't mean that because you get your period regularly that you're going to be able to get pregnant and stay pregnant. So that's another misconception. I think that even if you have regular periods, unfortunately, there are other things that can go wrong or other things that could be issues. So that's another big one. Other fertility myths. I mean, I've had people ask me, speaking of supplements and things like that, the things that they read on the internet, drinking Robitussin, taking Mucinex to thicken their yeah, I've had several people, and that's something that's big out there that people read about, that it will thicken their cervical mucus and increase their chances of pregnancy if they take those things regularly. We don't need any. Yeah, that's out there. That's a big one. I'm trying to think what other big, those are like the major one. The birth control one, I got to tell you, comes up so often. I mean, I can't tell you how many friends ask me that one.
Right.
The birth control one is huge.
Okay, cool. Thank you. Ashley has another question. I'll get it put up on the screen.
Yeah,
is there anything we can control in terms of diet for fertility for men or women?
Diet is another big controversial one. Again, if there was one specific diet that really proved to work, every fertility clinic would tell their patients to be on it. I've seen a lot about gluten-free, dairy-free, either someone doing both or just one of those. I think that, again, there are definite health benefits for gluten-free, dairy-free diets. What ends up happening, though, I think, is that people get so amped up on it that it becomes counterproductive, and the stress that it's causing is actually worse. I have patients that will accidentally have soy sauce, for example, when they're on a gluten-free diet, not realizing that soy sauce has a tiny little bit of gluten in it, and they freak out and think that derails everything. So I find those kinds of things to be counterproductive. Most nutritionists who specialize in fertility will not tell you to go on a restrictive diet. They will tell you to have a Mediterranean diet that's high in healthy fats, low in carbs. Now, again, that doesn't mean no carbs. It just means you want to eat healthy carbs. So most nutritionists who have actual masters, of science in nutrition and are specialized in fertility, will likely not have you on a restrictive diet, but they will recommend a Mediterranean diet. Same goes for men and women, because if your body as a whole is healthy, it should technically help with everything. But for men, they have it a little bit easier than us, of course. Their sperm and things like that shouldn't really be affected by these things. Sperm can be affected by smoking. Marijuana use of any kind can definitely affect it. Hot tubs, compression shorts or pants, bike riding, a lot of avid bike riders, those kinds of things can affect sperm. But the thing with sperm is that it's much easier to reverse. So within like 3 months of us making those changes, sperm quality usually improves, whereas egg quality doesn't really happen in the same way. Anything the dads should be doing. Again, those are really the lifestyle things that impact sperm. One thing that dads should definitely be doing is having a semen analysis. We have so many patients who the partners don't want to. To be quite frank, I don't know if it's like a source of like pride or people always assume that it's a female issue, and that's just not the case. And so I highly recommend, and they will recommend this at your initial fertility workup, to have your partner tested. And I wouldn't drag my feet on that. I think that it's, again, how would you know if you are producing semen, but you don't have active sperm? How would you know that if we don't test it? So I think having a semen analysis is very important.
Yeah, great question, Tanya. Thank you. And thanks for calling that out, because it just feels like it's always such a huge burden on the woman. Like, I just hate that in most cases, I assume she probably always thinks it's her body. And I'm glad that you made the shout out to get the semen analysis.
Oh yeah. Yeah. It's important. It's a huge
Definitely.
part of the workup.
Right. In your experience, I assume, Ashley says, agree in all caps. In your experience, and this is the hard part about infertility, like everything just feels so gray. And we've talked about this too, but are there any common reasons that you see for infertility?
Reasons for infertility. Again, I think your period is a big one. And one thing that really affects your period is weight, unfortunately. So two things that as females, we don't love to talk about, but that are so important when it comes to reproductive health: your age and your weight. We hate to talk about those things. I used to hate telling patients about their age related fertility issues because people get so defensive. And especially if you don't feel your age, or like I said, you're a really healthy 48-year-old, it doesn't matter. Your biological clock kind of is what it is. And so age and weight. So if you are either spectrum, so super underweight or super overweight, those can have detrimental effects on your ovulation, and so we have a lot of patients that are underweight, and so they're not getting their periods because of that. They're not ovulating. And same thing with our overweight patients. Their ovulation is all messed up. So they'll either have PCO-like symptoms, PCO-like ovaries, polycystic ovaries, and that can gravely affect your fertility as well. So I think that weight can definitely be a huge factor. And again, age. We know that in a certain window, our chances are just higher. And as we get older, our chances get lower and lower. That's just biology that we haven't caught up with yet.
Yeah. Yeah. Thank you for sharing that. That's tough. You're right. And I don't think women specifically want to talk about either one of those. That's really hard.
It's very hard. It's very, very hard.
Okay, so I like to do a time check. We have 10 minutes left. So if there's anyone that has any question that you're just like, I really want this answered before this webinar concludes, please put it in the chat. Otherwise, I just have like one or two more that I'll ask Leyla. One of the things that, I always like to ask people is, if you have a friend that is going through infertility or loss, how can someone who isn't be there for that person?
Yeah.
What are some things that we can do to show our support in a way that I think would be like really meaningful, even though we just like really truly have absolutely no idea what they're going through? What are some recommendations that you'd be willing to share?
One, I feel like there's more don'ts than do's.
Yeah.
I think that
We'll also take the don'ts.
I think the best thing that you can do, and I've been through late losses, especially, like, so I know the things that people have said or haven't said or have done, haven't done, is just say, hey, no obligation to respond, but I'm thinking of you. I'm here for you. And I'm so sorry. Done. Don't ask a bunch of questions. Don't ask how far along someone was, as if that even matters when you have a loss. A loss is a loss. Don't, if they're not responding or you don't hear from them, don't keep nudging them. They you need to give the space as well.
Mhm.
And that's why I always start it with, do not feel obligated to respond. I just wanted to let you know that I'm thinking of you. Um, don't say, well, at least, right? A lot of people say to me, well, at least you have kids already, right? That doesn't make anyone feel better. I assure you that doesn't make anyone feel better. Well, at least, or another one that I think is really harmful is everything happens for a reason. No, oftentimes that's not the case, unfortunately. And saying that to somebody who's had a loss is just, it's not helpful. Nobody wants to hear that everything happens for a reason or everything will work out the way that it's meant to. God has a plan. Those are just not helpful things. I think the best thing you can do is let them know you're thinking of them. And sometimes it's good to just ask, what can I do for you?
Yeah.
Can I bring you a meal? Can I bring you a coffee? Can I, if you are experiencing secondary infertility, you have a loss, and my friends offered to like take my kids out. Ask and say, what can I do for you, if anything, that would be helpful?
Yeah, thank you very much for sharing both sides of that. I think it's always like a really important reminder what to do and what not to do. Yeah, thank you for sharing all of those.
Yeah, no problem.
Okay, Ashley has a question. I'll pull it up on the screen. Would you try IUI first and then IVF after, or vice versa? Other options? Question mark.
So it really just depends on your medical history. Unfortunately, that's not a blanket statement. I will tell you again, some insurances will require you, now less and less so, but there are insurances that will say like you have to do 6 IUIs before we'll cover IVF. But it really just depends on your medical history. IUIs are great for same-sex couples, same-sex female couples that are using donor sperm. IUIs are great for timing purposes. If somebody kind of has an irregular cycle and like they don't know if they're hitting their ovulation window. IUIs are great for if somebody's sperm issue is motility and motility and like forward progression of the sperm. We can take the sperm and put it exactly where it needs to go to. So those are the instances where IUIs are really helpful, but they really only increase your chances by about 10 to 12%. So like, let's say 30 is the baseline, you're increasing it by 10 to 12%. Yes, I always say though, if you are in the realm of doing IUIs first and you'd rather not jump right into something more invasive like IVF, give it like 3 or 4 tries. After 3 to 4, your chances aren't increasing each time you do one. So not to say like don't waste your time. I hate to say that, but after 3 or 4 cycles of IUI, if it hasn't happened, I would at least explore IVF so that you have a backup plan. There is a lot of prep that goes into IVF. It's not just like, oh, I got my period, I'm going to start IVF today. That's not how it works. There is a lot of prep work that's involved. So you can always, have it set up for if your IUIs don't work or haven't worked.
Is there a lot of prep for IUIs?
No, not really. The only thing that you want to make sure of is that your partner, if you have a partner, that your partner is able to be there in that time frame that they would do the IUI, or they can freeze sperm ahead of time, anticipate that. And then if you're using donor sperm, it's frozen and we can thaw it anyway.
Got it. Okay, cool. All right. Well, we are almost at time. So my favorite last question, unless anyone has any ones, we'll get them answered. But I always like to ask Leyla if there's like one thing you want to make sure people hear and leave with. Like, what is the one thing you hope people take away from today's discussion, or just in general about this topic?
I would just say, like, when in doubt, just go and have it checked out. That rhymes. That sounded so cool. But really, just I always encourage every single person who is curious about their fertility, even if you're like, no, you know what, I'm 25, I'm not even thinking about that. Like, if you have the means to do it, when in doubt, don't wait. Go have the fertility workup done. Best case scenario, they're like, you're great, give it some more time and come back. And worst case, you find out something that you wouldn't have known, and you haven't waited 5 years to find that out, and that gives you more time. So I would say, when in doubt, just go have a fertility workup done and use resources such as Dandi so that we can guide you through who to go to and what to ask. Like, I have this one sheeter of questions that I give to people to bring to their new patient appointment that says all the things to anticipate happening and all the medical records to bring with you and all the questions that you can ask while you're there.
Awesome. All right. Well, as a reminder, we will send a post webinar email, which includes like helpful resources from Dandi, a link to the recording, how to contact the team at Dandi in case you guys have any follow-up questions. And then, yeah, so thank you guys so much for being here with us, Leyla. I really appreciate your time and everything that you shared. And thank you for being so open and transparent with us. And hopefully everyone learns something new and feels empowered to continue trying and growing their family. So thanks, you guys. Appreciate it. Happy Friday.
Thank you for having me.
All right. Have a great weekend, everyone. Thanks so much. Bye.
Bye.